Hello, my name is Michelle McLaren, and I welcome you to the ABCs of Health Insurance. I am a licensed health insurance broker with my own agency, Just the Facts Insurance Agency, and I'm also a licensed health insurance counselor in the state of Texas. I am here to help explain the confusion that is health insurance, especially for individuals. Insurance is evil. Let's turn evil into easy with some answers. Today's letter is E. E is for essential services, also known as the essential health benefits. These are 10 categories of benefits that the Affordable Care Act requires a health plan cover in order to be a qualified health plan, meaning it keeps you from paying the tax penalty, and you may possibly qualify for tax credits to help you pay the premiums. One important note, these benefits have to be covered, but they do not have to be covered first dollar. You may have to pay your deductible in part or in full before these items are covered as part of your plan. It may also be required that you go to an in-network physician or facility to be covered, and it is the patient's responsibility to confirm that that doctor or facility are in-network. If you know your doctor's in-network and he sends you to a lab, you have to make sure that lab is in-network as well. Just because the doctor sends you there doesn't mean it is. So let's go through these essential services. The first one is outpatient care. This means your day-to-day visits to the doctor. You go in, you go out again, outpatient. The second is emergency care. This is attending an urgent care facility or an emergency room. However, those two are very different for your insurance company, so keep that in mind. If you are in an emergency room and it is a life-threatening emergency, this is one time when you can go out of network on your insurance. If you think your life is in danger, you need to go to the closest ER and get help or call an ambulance if necessary. Don't worry about networks at that period of time. However, if you're out of town and need a flu shot or a sinus treatment and go to an urgent care, they're probably not going to rank that as an emergency. It's always best to know where the closest treatment centers to you are, where it's back at home or while you're traveling. Number 3 is inpatient care. This means you have to be checked into a hospital. Pre- and postnatal care. So what care for you while you're pregnant and after your baby is born. This includes immediate care for your baby as soon as they're born. You have coverage for your baby on your insurance plan, and you have 30 days to let the insurance company know about the birth of your baby and get them registered into the system and added to your policy. We have mental health and substance abuse disorder services. This is huge. So many plans never covered mental health care before the Affordable Care Act was put into place. So this is behavioral health treatment, counseling, and psychotherapy. This also includes the medications recommended by therapists in these areas that can help a whole lot of people. The tricky part is that not all mental health professionals take insurance. So just because your insurance covers it doesn't mean your psychiatrist or psychologist or therapist takes it, and sometimes that can involve some tricky balances. Prescription drugs is an essential service. Not all plans covered prescription drugs in the past. This is still causing an issue for people though, because the drug you take doesn't necessarily match with the formulary for your insurance company. Let's say you take a medication that is a newer medication and there are older medications for the same treatment. The insurance company may agree to pay for the older ones, but maybe those didn't work for you. So you may have to go through some work to convince the insurance company that you need the newer medication. The reason they argue is that medication is probably a lot more expensive. Recovery and rehab services are covered. That's physical therapy, medical devices, sometimes inpatient or home health care. Lab tests are covered. This can be anything from a simple blood test to a major scan like an MRI or a CAT scan. Now, these are frequently in the system where you have to meet your deductible first. And some people have found that if they go to, say, get an MRI on a knee injury, that it's cheaper to pay cash than to put it on their deductible to meet their deductible to get that covered by their plan. And this is some decision you have to make. If your MRI is going to cost you $1,500 if you use your insurance and $500 if you don't, you might want to just pay that $500, but then that $500 will not apply to your deductible or your max out of pocket. Preventative services. This was big. If you're going to stay healthy, you need regular checkups. So preventative exams are covered at no cost to the patient. This does not mean everything that your doctor thinks should go in an annual checkup is covered. There's lists out there, and they really have to make sure they follow those lists. However, make sure you talk to your doctor when you're ready for your annual exam and get everything as covered as possible. Pediatric, vision, and dental services. This is for kids 19 and under. So even though you can keep your kids on your policy until they're 26, they only qualify for these pediatric services until they're 19. It can be really great. A free pair of glasses and exam for your kid every year, and dental services if they're covered. Wait, didn't you just say it was an essential service? Yes, I did. But they created a lovely loophole that I do not approve of. The insurance company is required to make sure that you have dental coverage for your children. It doesn't have to provide it, and they can charge extra for it if they put it in their plan. I wish they would have just built it in and left it there. Now, there's a few other things that plans have to do, like covering pre-existing conditions, which have no annual or lifetime limits or caps on what the insurance company will have to pay. And these requirements all add together. All these things add up and make the insurance cost more because there's more cost for the insurance company. If they have to pay for your maternity, when they didn't cover that before, that's an expense for them. They have to pay for those lab tests, pay for those medications, and they could refuse that before, that's an expense for them. And if you're on a cancer medication or an arthritis medication that costs thousands of dollars a month, they can't say, oh, we're going to pay $10,000 and stop. They have to keep paying because there's no caps. So all of these requirements have ended up increasing the premiums for our insurance because they're costing the insurance companies more. Now the question is that worth it? And that's something that's being debated quite a bit. I know that I want my friends who are diabetic or who have a cancer history to be able to get coverage without having to pay a fortune for it. But that can really hurt some people who are healthy and need coverage as well. I'd love to hear what you think. Tell me what your opinion is on whether these essential services are improving our insurance or not. Thank you for taking the time to listen to me today, and I hope you found this information helpful. Do you have other health insurance questions? Check out my other videos or leave your questions in the comments. Education is important. That's why I created Just the Facts Insurance Agency. I want to give you just the facts you need to protect those you love. Peace and health to you all.